Welcome, everybody. Thank you so much for coming. We are in session 2 of our 2019 open enrollment benefit information session. I am Sherry Geeton. I am our Chief People Officer, and I had a lot of help this year in getting our benefit program up and going. So I'd like to introduce all of the people who helped us do that. So I'm going to hand the microphone over to Megan to start. Come on in, you guys.
Welcome. So I hope everyone knows me already, but I'm Megan Berg. I'm your Senior HR Manager.
Hi, everyone. I'm Julie Gunhus. I'm HR Specialist, and Payroll and Benefits is my specialty.
And Laura Numata is not here, but she helped us with our materials this year. And I want to introduce Brenda Cox. You guys know Brenda. She is our new account manager on the HMA plan, and we are just so thrilled to have her. She helped us so much this year. We're really excited to have her on our team. We also have an audience on Skype as well, so we have some additional people who are not in the room with us. So for our schedule today, we really want to give you guys a ton of information. So it's going to be information heavy, graphics light. So we are going to do a quick overview of changes and what you can expect on the plan. Then we're going to take a deep dive into the plans themselves and how they work. Megan and Julie will do that. Oh, excuse me, I meant to introduce our guests as well. So I'll go through this and then I want to introduce our guests as well. Carolyn Barbie will introduce and talk about our 401k plan, the Roth and the match there. Amruta is going to talk to us about our health and wellness products. And Amanda from Health Equity is going to talk to us about HRA and the FSA. So I'm going to really quickly let our folks introduce themselves. We're so happy to have all of our guests who are going to educate us about their products.
Hi, I'm Carolyn Barbie. I work for ClearPoint Financial. We're independent investment advisors, and we help you guys with 401k questions. And if you want to figure out how you want to invest your 401k, we can help you there too.
Thank you. Dan Rickert, Willamette Dental Group, one of the 2 dental options you have here to choose from. So feel free, come up, grab some free stuff, ask me questions, whatever you want to do.
Clean teeth. After lunch, brush your teeth.
I'm Cassidy. I'm from Energized Chiropractic and Wellness.
I'm Dr. Michelle, also from Energized Chiropractic and Wellness, and just wanted to let you guys know our services are available for your plan.
Thank you. Hey, Brian. Welcome.
My name is David Inner, and I'm with HMC HealthWorks, and we are kind of the behind-the-scenes people that administer the Wellness Hub and your wellness program.
Hi, everybody. I'm Amrita Vyas. I'm your Senior Product Manager here. So we are here to talk about all the products that you have as a part of your benefit.
Hi, everyone. I'm Amanda Riley with Health Equity. We administer your HRA and your FSA, so we'll talk about that in a little bit as well.
Awesome. Thank you. Thank you, everybody, and welcome for thank you for coming. So happy to have you guys here. Okay, so that's our schedule. Feel free to come up and sit wherever you like to, Eric, if you want to, or you can stand. It's up to you. Yep. Okay, I won't go into this too much because Megan's going to talk a little bit more about this, but I just wanted to say from a plan perspective, what we are looking at, the team of folks who are responsible for putting together our health plans, we're looking at the wellness wheel. Essentially, we're looking at all of these components and making sure that we are touching every single one of these components as we're putting our plans together. We believe that having a balanced lifestyle or a balanced, each part of this wheel, a balanced part of your life, creates a stronger well-being for you. So that's what we're trying to do. So what's new in benefits for 2019? We have some upgrades to our 401k. We'll talk about that a little bit more. We added hearing hardware and weight management options to our healthcare plan. We are changing carriers for our life insurance and increasing our life insurance amounts. And we have a new gym reimbursement program, which you guys will really like. Nice and easy to administer. So from the standpoint of life insurance, we are changing carriers. We are moving from LifeMap to Mutual of Omaha. We are increasing our life insurance amount. It'll be one-time salary up to $200,000. Currently, we have one-time salary up to $50,000. And we are reducing the number of days from 60 to 30 for eligibility. Also, on the life insurance, overall for HMA, the cost of the life insurance went down. So even though we raised it to the guaranteed issue to 200,000, the rates went down for HMA, so that's a bonus for us. Voluntary insurance is, the rates went down there too by changing carriers, so that is a savings for you guys if you choose to add any additional life insurance for yourself or any of your dependents. And on the long-term disability, we were able to increase the weekly maximum that people are eligible for. So you're still eligible for 60% of your salary. It's just that the weekly maximum amount went up. So by pressing hard on our vendors this year, we were able to increase our benefits, but actually reduce the cost to HMA. So remember, this is a 100% HMA paid plan. On the 401k, so we had some changes this year. Started actually, right now they start on 11/1, and we're really excited. The biggest change that impacts new hires and people who have been here less than a year is that we are starting to match your contributions after 90 days of employment, so or 90 days from start date. First of the month following 90. We have to make it as complex as possible. So first of the month after 90 days, we will begin matching. So in the past, that's actually been 12 months. And so we've been able to shorten that down quite a bit. And then in addition, we added the Roth option, and Carolyn will talk to us a little bit more about what does that mean and what considerations you should make before deciding to use that. Let's see. For 2019, so this is a federal regulation, the maximum contribution that you can make is $19,000. So that's up from $18,500 from for 2018. And if you are over 50, you can add $6,000 in additional dollars there. I wanted to talk just really quickly about the match on the 401k. I want to make sure everybody knows that we have a safe harbor match. And what that means is that you are immediately vested in the matching funds that we issue to you. So if you put in 3% of your salary, we actually match that at 100%. So if you put in $100, we put in $100, HMA puts in $100, and that money is yours immediately. So if you did that for 12 months, you put in $1,200, HMA puts in $1,200. At the end of that year period, you have $2,400. So it's essentially it's free money. And then in addition to that, on the next 1 to 2% that you put in, we will match 50% of that. So if you're putting in $100, we're matching $50 on that. And it's called a safe harbor match because you're immediately vested in that. Many plans have a vesting period where you have to wait to get those matching funds. So this is a pretty incredible option, and you're truly wasting money if you don't invest in our 401k plan. Questions about 401k? Okay, so we're going to talk a little bit about the medical and the prescription plan now. So before we go into that, and Brenda's actually going to share with us a little bit about the plan changes on the medical and the prescription, I wanted to let you guys kind of know where we started out. So about mid-year, the team and I got together and said, okay, what do we want to do for 2019? We looked at our survey results that we did back in, I think, April of 18 to see if there was any feedback there. We started talking to people out in the company and said, hey, what more do we need to do with our health benefit plan? So we got some input that way. We actually took the data from our awesome data and analytics team here at HMA, and we took that to an actuary. And we said, can you look at this data for us and tell us what you are projecting for claims for us for 2019? And he actually went back. So he took 3 years of data, and then he projected forward 1 year. And where he came back and said, you guys need to raise your rates 32.4% to manage all of the claims that have been coming in. And this team, at this point, this is when Brenda joined us as part of our team, and she said 32.4, and we said the same thing, 32.4, you've got to be kidding. So that would have been a 32.4% increase for you and a 32.4% increase for HMA. So this team got together and said, okay, we can't do that. So what can we do? What should we do with our plan to bring down that increase? Knowing we're going to land with an increase one way or another, what can we do to bring that the increase down? So we actually considered, I don't know, probably 12 different options. How best can we bring the cost of the plan down at the same time that we are continuing to offer awesome benefits for you guys? And so this is kind of where we landed in terms of the changes that are going to be occurring. So by making these changes, we were able to reduce the increase to 20 to 25% for HMA and 15% for employees. So you will have a 15% increase on your premiums for your medical and prescription plan for 2019. And the only way we were able to get that down to the 15% was to actually make these changes. So I'll let Brenda talk about the changes, and then if you have some questions about the changes, you can ask those.
All righty. Good afternoon. So let's start with, first change is the prescription drug plan. So the only change there, it's still with Costco. The only change is the generic copay is going to go up to 15 and double that for the 90-day supply. And that kind of gets us in line with what the market is doing. The $7 copay we had was a incredibly rich benefit. So that'll be 15. Urgent care is going to a $30 copay. Presently it's 25. Specialty office visits are going to a $30 copay as well. Your regular office visit with your primary care will still be 25, but if you have to go to maybe a dermatologist or cardiologist, something like that, those visits are generally about twice the cost to the plan that a regular office visit would be. So getting a little bit more copay on that will help offset some claim. And we're restructuring the ER visit. It'll still be the $250 copay when you go to the ER, but then it's going to be subject to deductible and paid at the 80-20 coinsurance split. And we're hoping that that will encourage some folks maybe to give more consideration to urgent care. Remember, that's just a $30 copay, and pretty much anything they do to you at the hospital, they can do at urgent care. And the cost of an urgent care visit is about the third of a cost of the hospital visit or an ER visit. So hopefully that will help us with some consumer-driven healthcare decisions. Next, we're going to restructure the way that the HRA is administered. So presently, it's what's considered a first dollar HRA. So we're restructuring it so that it pays on the back end of the deductible. So our deductible is still going to be $750, but all members are going to be responsible for the first $450 of deductible. And then the HRA will kick in for the remainder of the deductible and potentially coinsurance, depending on how many people you have on the plan. It's only going to be available for deductible and coinsurance. So you won't be able to use the HRA for copays anymore. We had Amanda here today from Health Equity because she's going to talk about how to sort of marry together the HRA and the FSA so that you can best utilize your resources and cover costs that you may already know you're going to have. And remember, everybody can take a look at your MyRGA website, and you can clearly see all your claims, all your everything that you've spent, all your copays, prescriptions, everything that's on there. And if anyone needs any assistance, please come see me. Please ask me to help you. I'm so willing to help people understand. And then last but not least, if your spouse is eligible for their own employer-based group plan, then there will be a $50 surcharge per month for them to remain on our plan. So we're hoping that spouses that are eligible for their own plan will be on that plan. And if they still want to be on our plan, then there is a $50 charge, and that is just for medical. It does not apply to dental or vision. Does anyone have any questions? Yep. The surcharge? Okay, so if your spouse is working and eligible for their own employer group plan, so it's not an individual plan, just an employer group plan, then they should consider being on that plan. If they still want to be on ours, $50 surcharge per month. Any other questions? All right, turn it back over to Sherry.
Thank you, Brenda. Okay, so up here we have the rate chart. So please keep in mind that HMA has not had a rate increase for employee premiums for more than 3 years. So we're doing the 15% now. And then in addition to the 15%, what my team and I, and Brenda, even Amruta has been working with us as well, we are planning 2019 communication strategy. So how can we support you in using our plan in the best way possible for you? At the same time, we try and get control of our claims cost. And so during the year of 2019, you're going to see an abundance of health and wellness communications from our team, encouraging you to use some of our other products that Amruta is going to talk about, and how to, essentially make sure that you're doing preventative, make sure that you're doing your maintenance medications, that kind of thing. So we're going to be doing a lot more communication in 2019 to see if we can't get control of costs, and then the hope would be that in 2020 we don't have to have another increase. So that's our plan. So you can see on the rates here. So here's our employee. I'll just do the non-smoker rates. So essentially, that's a 15% increase over where we were last year. HMA is paying 86% of that cost for employees. Same thing here, 15% increase over where we were last year. HMA is paying about 68% of that. 15% cost for employee plus child or children, and HMA is paying more than 70% on that. And then on the employee plus family, same thing, 15% increase over where we were last year. And HMA is paying around 65% towards that to assist you. Questions about rates or any of the changes that we have coming up? Okay, I'm going to turn it over to Megan and Julie, and they're actually going to take a deep dive into each of the plans, and then the rest of the people in the room are going to have an opportunity to chat as well.
All right, thank you. So Julie and I are going to do a basic overview of the medical, dental, vision, and prescription. If you guys have gone through new hire orientation in the past year, you've probably seen a lot of this stuff already, but I just want to make sure everyone remembers all these critical key numbers and has a basic overview of everything. So with the medical plan, remember that preventative care is always covered at 100%. So if you're just going in for your annual physical, covered at 100%. There's other services based on your age and gender that might also fall under preventative as well. So those are 100% paid for. Co-pays for office visits, if you're going to go see your primary care, those are going to stay at $25. As Brenda mentioned, if you're going to go to an urgent care or a specialist, those are going to go up to a $30 copay. Our deductibles are going to stay the same, and I'm really happy we've kept these relatively low compared to a lot of other plans that I've seen, so we should be really happy about that. The individual deductible is still going to be $750. For the family, it's $2,250. We're not doing anything to our coinsurance, so after you've hit that deductible amount, it's still going to have that 80-20 split when you're in network. So the last thing, the important number to know is that out-of-pocket maximum. That hasn't changed from last year either. It's still $2,500 for an individual and then $7,500 for a family. Is there any questions on kind of those basic numbers? These sound familiar to everyone, hopefully. Yeah? Okay. So the next thing with the medical is the prescription piece. Remember, we have our out-of-pocket maximum for medical, but we also have one for prescription. This hasn't actually changed. This is the same as this year, but there are just two of those numbers to be aware of. Brenda mentioned our retail pharmacy, that 30-day dispensing limit is going up for generics to $15 copay. And then our brand name formulary and non-formulary is not changing. It's the same as it was from previous years. The mail order piece, so if you are on maintenance medication and you're getting mail order, remember you're going to need to change it to the 90-day supply. It's not 30 anymore. And then the cost for the generic on that is $30. So again, you're getting 90 days for just twice the cost of 30 days. So there is a savings to doing mail order. One thing I'll remind everyone is if you are on maintenance medication, you have 3 refills at a retail pharmacy, and then you're required to switch to mail order. I'll say that again. So if you have a maintenance medication that you're on regularly, you can go to Walgreens or CVS or wherever you want to go to pick it up. After that third time, you need to switch to mail order. I always remind people to not wait until they've picked up that third refill to try to figure this out. Do it once, and if you know you're going to need to be on this medication forever, you have high blood pressure, for example, start working on transitioning it to mail order as soon as possible. A lot of the times you'll have to go back to your doctor because they've written you a 30-day prescription, and you need to have it be a 90-day. So start working on those, work through those issues so you're not waiting and it's not covered at that retail. Is there any questions on that piece? For the mail order, you can. Yes. Yes. If you want to have it delivered to your house, you can do that too. But yeah, you can still pick up your mail order at Costco. You don't need to pick up your 30-day supplies. You can go to Walgreens, CVS, wherever you want to go. Okay. I'll let Julie talk about dental.
All right. Let's talk about dental. So the dental coverage really hasn't changed too much. We still have two options. We have the HMA or RGA dental, and then the Willamette dental, which is the HMO. And here's some of the benefits of that. Again, they're same as they were last year, so nothing has changed on this, but just a refresher. The RGA dental, you can go to any preferred provider. Obviously, with Willamette, you need to go to a Willamette facility. So that's one of the main differences there. The maximum yearly benefit for the HMA dental is $1,500. Willamette is unlimited. The deductible for HMA is $50, and there's no deductible for Willamette. And then your copay, there's no copay on the RGA dental, and $15 on the Willamette. So 100% routine exams covered through HMA, and the $15 copay, and then 100% for Willamette. I won't go through the rest of them, but basically you can see the differences here. Definitely something to consider when you're thinking about yourself and your family and what your needs are for dental. So two great plans with just two different options here. So any questions on the dental? All right. Again, here's your rates for dental. They have not gone up. Possibly Willamette went up just like 3%, but the HMA dental has stayed the same. But these are your rates for dental. Any questions on dental? Pretty easy. All right, vision plan. The vision plan has not changed either, so it's the same. You get an annual routine eye exam, which is paid at 100% after your $25 copay. And that is through RGA, your exam. And then you get a $300 allowance for hardware, whether it's glasses or contact lenses, up to $300 paid per year. And you do need to be enrolled in the plan to access that coverage. So, anybody have any questions on that? Yes. So you basically just go to wherever you're going to have your exam or where you want to get your hardware, and you just can either email, fax, or download your receipt into the RGA site, and you get reimbursed that way, as far as I know. Right? Yeah. I just did mine, so we'll see how it goes. So yeah. So yeah, I just went to Costco and had mine done, and so it's just pretty easy. You just submit your receipts that way to be reimbursed. So you also can use your FSA, but they'll talk about that more in a little while, right? So here's your rates. They haven't changed, so same rates as before. Pretty affordable. So any other questions? All right, back to Megan.
Okay. I'm really excited. I get to talk about wellness before I even get going because I know I'm going to forget. You may have seen these. Grab one of these and fill them out before you leave, please. This is just a form, a little quick survey. The wellness plan is really for you guys, and we want it to benefit, so we want to know exactly what things we should include. What does wellness actually mean to you? If you do that and you drop it off over here, you can be put into a little drawing for a Fitbit. So again, we want this program to benefit you and be things that you're interested in and are helpful. So give us your feedback. So one of the things that we did this year after Sherry came on is we kind of changed up our wellness program. We've done a really good job of doing wellness in the past, but we wanted to kind of refresh it and really focus on that holistic picture that Sherry was talking about at the beginning. So not just focusing on going for walks and doing your exercises and eating well, but it's financial wellness, it's mindfulness, it's all kinds of different things that go into feeling good and being well. So we've tried to focus each quarter on something different. I believe in Q1, Carolyn came out and did a presentation about 401k and saving for retirement, because that's a big burden that we all have to try to figure out. So that's a big piece of financial wellness. During the summer, our great interns did all kinds of activity challenges and recipes. So that's kind of the physical and the eating well piece. In this last quarter, as it is very stressful for all of you, and I want to thank you again for taking some time to come here. I know everyone is so busy. We're working on mindfulness and stress reduction. So just kind of having these different focuses throughout the year for wellness. So one of the things that I get all the time from people is, great, you have these benefits. I don't even know where I'm supposed to go to find them. I don't know where I'm supposed to go to track my incentive. You guys send out all these emails and I don't know where I'm supposed to go. So I'm just going to remind everyone that you can find the Wellness Hub through our accessrga.com. We've already talked about going on there and finding information about the benefits, your EOBs and things like that. But this is a great, really quick way. You'll have a tile when you log on, so you can go straight there. You won't have to have another login and sign on. It's just that one. Makes it a little bit simpler. So that's where you go to track your incentives, and I really encourage people to do that. If you go on there and do a couple simple things, you'll at least qualify for one of the categories. It's really easy to get that 500 points. So that's $500 that you could have to spend on whatever you'd like. So go on there and make sure that you're looking at all the other resources. There's great things on the website as well. I'm really excited about this. How many of you do gym reimbursement right now? Exactly my point. Right, it's really complicated. You have to track your visits, you have to go on SharePoint, you have to get approval, it's quarterly. There's a lot of things that go into it. I'm guilty of not doing it myself. So we wanted to make it a lot easier for you guys by changing the program up a little bit. So now, if you're going to a gym or you take fitness classes, in January, you'll need to just submit a receipt showing us that you go. We'll turn on your reimbursement and you'll get your $30 each month put on your paycheck. And then again in July, we'll just ask you to again submit a receipt or an invoice just showing us that you haven't dropped out of the gym, you're still going. You won't actually have to go and track how many visits you're doing or get any paperwork from the gym other than just a receipt to us. So we're trying to make it really easy for everyone to do, and we're encouraging people to take advantage and to go work out, even if it is just 6 times a month, like I might be able to find time for. Exactly, right? So again, this is a great new benefit, and I hope to see a lot more people than just 3 participating next year. So. I would think so. I'm not sure if that's like a country club membership. So if it's not that and it's actually a tennis, yeah. Or if you don't do gym but you do yoga, I did that for a long time. That's still a fitness class that would qualify. Or if you do cycling or you do something else, just so long as you're doing a regular fitness class. Okay. The last thing I'll remind you about for wellness is that there's a ton of different discounts on accessrga.com. So one of the big ones that I'm going to point out is the fitness discount. I know Jen Tucci actually sent out some information a couple months ago about this, and it's $25 if you are going to certain gyms. It's kind of limited, but if you sign up and are doing that, you could have the whole thing actually reimbursed. So it's a great area to find some discounts that are related to your health. So go on there and take advantage and save some money. The last thing I'll say about wellness is, again, give us your feedback. But if you have thoughts or want to be more involved, you can always let Kristen Hardy know or Laura Numata. They're going to be kind of heading up our wellness program next year. So we would love your feedback and involvement. So any questions on wellness? All right. Carolyn's going to talk to you guys about retirement then.
Numbers, yay.
I'm Carolyn. We've been working, actually, your HMA team has been working really, really hard on, I'm gonna stay out of this light here. It's kind of like, your HMA team's working really hard on improving the 401k plan, and it just makes us really, really excited. The change in the matching waiting period was huge because a year is a long time to be out of the market, and especially when the market's doing as well as it's doing now, a year was a really long time. So, kudos to Sherry to be putting that through. So please, there is no excuse now for not participating, and the matching contribution is great. Put in 5, get 4. Experts say you should be putting in between 10 and 12% into your 401k starting in the beginning. And if you are here and you put in 5 for your at 9, you're almost there without even any effort whatsoever. So that's good. One of the things that we did add is a Roth contribution ability. So basically what it is it's a different type of contribution. So you can actually now make contributions, and they're actually put into separate buckets. One is a pre-tax contribution. That's what you've done, and the money that you put into your plan is not taxed currently. It grows as you put in money and as the matching contribution grows. And whenever you do take the money out at retirement, you're going to be taxed at whatever tax rate you are at that time. Alternatively, the Roth is almost a little bit opposite. The idea with a Roth is that you pay taxes on your current contribution. So you pay taxes at your current rate for the money that you put into the plan. And it's kept separate in a separate bucket from the pre-tax. But if you keep it in there for 5 years, the Roth, all of the gain on that Roth principal is not taxed at all. So when you get a distribution at the end, sort of at retirement, you've already paid taxes on the principal, and all of the earnings are now no longer taxable. It's a great benefit, especially for young people who have a long time to invest and can have, a nice 30-year run of tax-free money. That's fantastic. It's going to be an individual decision for each person, because it's going to depend a little bit on what your tax rate is now, what you think your tax rate is going to be in retirement. Tax rates are right now at a historic low, so it's going to be a little bit hard to tell. I guess after today, we'll see whatever happens with the government. So if we can turn to the next slide, I've just got a couple of examples. Oh, Roth. So if you think that your tax rate is going to be higher at retirement than it is now, pay the taxes now. You're not going to pay anything on the earnings. If you think that the tax rate, of course, is going to be lower, then wait and get your distribution and pay the lower tax rates. So again, I think it depends a little bit on where you are in your career. If you're in the beginning of your career, not only do you have a lot of time for it to grow, but you're probably in a lower tax rate than you will be later on. You don't have to choose all or nothing. You can choose 50% in pre-tax, 50% in Roth, all in Roth, 10%. Both of them are subject to that $19,000 limit, though. And both of them are matched. So the matching contribution is going to be on whether, it doesn't matter if you put in pre-tax or Roth, the matching contribution is always going to go into the pre-tax because we can't tax you on the employer money. I gave 2 examples here, and then this again, really, it depends, a lot of numbers, sorry. It depends on how much time you have, what the rate is, and then again, what your current rate is versus your future rate. So for instance, in this situation, I've got a 45-year-old, 65 at retirement, so we've got 20 years of earnings at about 7%. But the current tax rate's 25%. It's one of the higher tax brackets, and the retirement is probably going to be a little bit less because they're probably going to make less in retirement. So in that situation, we do the numbers. They save $10,000. Again, in a Roth, you're essentially only putting in $7,500 because you're paying some for the taxes. But after 20 years, in this situation, it made much more sense for this participant to put in pre-tax money. And again, there are Roth calculators out there. Please give us a call. We're happy to help you walk through it and decide for yourself. And then the next situation, Again, this is the reverse. So the current tax rate is less than what they think the future tax rate will be. And in this situation, again, this same thing. Instead of the 25%, it's 15. But in this situation, over that same 20-year period, it made so much more sense for this person to put in after-tax money. So again, like I said, it's an individual situation. But the fact that we now have the ability to choose and to have sort of after-tax money, non-taxable money growing in our 401k is a great benefit. And I would hope that you at least would run through the calculations, or you can just give us a quick call. We can help you with the calculations. But it is part of a real nice diversified portfolio that you guys are putting in place. Yes, please.
So the $10,000 is cumulative of the 20 years that you're...
No, that's per year. Per year, sorry. Otherwise, that'd be great. Well, no, let me see. No, it's not. No, it's not. It's cumulative. Sorry, we didn't want to make hundreds of thousands of dollars here. No, again, it's going to be 7% for 20 years. We also use 27% as our estimate. In the last 10 years, it's been a lot higher, but we don't know if that's going to continue, especially tomorrow. Please don't change your 401k contributions tomorrow. After the election, it's always going to be a little bit wacky. Wait at least a month or give us a call. Hopefully we can help you out. But I'm here and I would love to answer any questions about your 401k or Roth or not to Roth, and we can go from there. So thank you very much.
All right, so this is one of my favorite sections that Amruta is going to be talking about. She's going to talk about our products and some of our programs that as HMA employees we get to take advantage of. These are a lot of the things that we promote out to our clients, and fortunately we get to try them all. So,
Hi everybody, good afternoon. So this is a perfect transition. We talked about financial wellness, now we'll talk about personal well-being. So HMA does a phenomenal job of offering all these products and services that can help you make a better decision each and every day, right? The first one that I want to talk about is our nurse line. You don't know if it's an emergency or a non-emergency situation, call our nurse line. The number is right behind your ID card. So you can find it there or it's online. You can go on our RGA member portal and find it there. So the number is right there. If you have any additional questions about nurse line, you know where to find me. But this is a 24/7 nurse line for any non-emergency situation. So something that you have in your back pocket, literally. Maternity program. This is our program. Again, nothing to take away from the OBGYN or the maternity nurse you're working with. This is kind of an add-on to that program. It helps you kind of guide through your pregnancy and help you make a better decision each and every day. And there are a lot of incentive, which you can see on the screen right there. So our vendor does a very good job with that as well. Again, the phone numbers are listed on the site. If you have any questions, you can directly call the nurse maternity line as well. The next one we have here is Care Advisor, or also known as our disease management program. We look at our prevalence and we know that top 7 conditions that are prevalent are listed here. This is an outreach program. So a vendor reaches out to you and you can opt out at any time if you would like to. But we highly recommend this because this is more like and maintenance program. So if you have a diabetic patient or a high cholesterol and you're working with your doctor, you can still enroll in this and talk to a nurse who is going to help you manage your condition even better. Our own Care Navigator program helps you where you're at. If you have any additional questions about your health plan, claims, finding the fair price, all of it, like they are fully integrated with all the other products. So it makes it even better for you to, even if you have smallest question about MD Live, you can call our Care Navigator and they can help you get there. So it's very well integrated. Our MD Live program, so I'm sure you all know about this. This is our teledoc. You can talk to a doctor 24/7. They can also prescribe the top 25 prescriptions and send it to your local pharmacy. So that's kind of like the highlight of MD Live as well, because if you are at work, not feeling that great, literally the wait time is less than 9 minutes. So that makes it even more efficient for you to call and figure out what's going on. Please download the app. It's very convenient, easy to use. We have Sophie chatbot that helps you how to register if you haven't registered. And I see some new faces. So if you don't know about MD Live, want to know about it, come see me so we can get you enrolled. And lastly, I think you also want to know that MD Live has a behavioral health program where you get to talk to a specialist related to stress or lifestyle, anything specific that you want. It is a private session with a specialist at just $10 copay, which is pretty amazing. Healthcare Blue Book is a cost transparency tool. For example, you want to get an MRI done and you don't know the fair price. It could be $500 or it could be $1,000. How would you make a better decision? You can open up the Healthcare Blue Book app, download whatever provider or hospital you're looking at, and then it will tell you the fair price provider. One caveat to this, please keep in mind, it is members' responsibility to figure out if it's in network or out of network. This app does not tell you that. So I just want to make sure, even if you feel that you're in a green zone, it doesn't mean the provider is in network. So just make sure you do that, or call our care navigators. They can help you very easily with that. And the last thing I want to point out towards Healthcare Blue Book, if you choose the green zone provider, you get like a range of incentive, like $50 could be choosing for a right in zone provider for Healthcare Blue Book. So there's a good incentive tied to it as well. So you should use it. It's pretty easy. All right, I think we have Amanda Riley here from Health Equity to guide us through FSA and HRA. Any questions? I'm right here, and you know where to find me.
Thanks, Amrita. Hi, everyone. We're at least the halfway point. So if you've made it, we're good. Okay, so we're going to talk about HRAs. We're going to spend a bulk of the next few minutes speaking about that because, as Brenda talked about at the beginning, there's some changes to the way that your plan is designed for 2019. So you just want to make sure you understand how to utilize this, what the system is doing on its own, and then the option that you have available for FSA elections. If you haven't taken advantage of the FSA before, this might be a good time for you to consider that just based off the changes on that HRA. So an HRA is an employer-owned account, which basically just means it's free money that your employer is giving you for specific costs. So there's nothing that you need to do to enroll in this plan except for choose the medical plan that's being offered to you by RGA. And that kind of already talked about that. I'm getting ahead of myself already. This isn't good. So basically what will happen if you have a plan today, you will receive a new annual election notice from Health Equity in a couple of weeks after all of the open enrollment has been closed. We will mail that to you. That will just describe what benefit level you're at and how much money is available to you and your dependents if you have dependents enrolled on the plan. But outside of that, the rest of this just kind of goes on and on. So if you're already a member with Health Equity today because you're on the HRA today, your login will stay the same, your history will stay the same, but you'll have a new plan year for 2019. This is a good visual representation of what that looks like. So the employer is going to give you money. It's going to go into the HRA, and then you can use the funds in the HRA to pay for eligible expenses. And the beauty of your plan design is that the system will actually do this for you, so you don't have to do anything. If you just enroll yourself, your benefit is $300. If you enroll with an employee plus one, if that's a spouse or a child, you'll get $450. And if you have more than one, dependent on your plan, your election amount is $600. This is kind of how your plan design works. We refer to this as a member pays first plan design. That doesn't really matter to you. What you need to remember is that you will be responsible for the first $450 worth of deductible expenses, and then the HRA is going to automatically kick in and start paying for your expenses that are deductible or co-insurance related. And we use a system called Auto Pay Provider, which is what you see down here. We go to the next slide. Thank you. And so one more. Thank you. And so as claims come into our system, we'll get that automatically on a file feed that we receive every day. It will look at your HRA and where you're at. If you've already paid the $450 that you'll be responsible for, then the HRA will just automatically start paying your providers. We get enough information on the file to pay that provider directly. So there's nothing that you need to do. We will just start paying the provider at $451 or higher. And you will be able to see all of that information directly in the member portal. If you're not already logged into the member portal with Health Equity, there's some slides in here that'll show you what that will look like. Next slide. 50% of your unused dollars of the election that your employer gives you will roll over to the next year. So if you don't lose all of it, again, it's free money. So, but 50% of what you don't use will roll to the next year and then be available to you in the following year. All the expenses on this plan run from 1/1 to 12/31. So you just want to understand that just like your medical deductible resets, your HRA is going to reset. And then next, we're going to talk about FSAs. How many of you are using an FSA today? That's about the proper percentage. It's usually somewhere between 10 and 20%. So if you've never used an FSA before, this is a way for you to put pre-tax money out of your own paycheck aside to pay for known expenses. The beauty of this, we go to the next slide, please, is that, like I said, this money is coming out pre-tax. You want to make sure that you're properly calculating how much money you can use. This is what the IRS refers to as a use it or lose it plan. So you can't carry these funds into the next year. So you want to make sure that you're only allocating what can truly be used. The IRS's maximum and what your employer has chosen as the maximum that you can put aside is $2,650. So you can't do any more than that. You could choose an amount lower than that. If you don't need $2,650, do not put $2,650 aside. So if you know you only want to cover like that $450 that the HRA will kick in after, you could put $450 aside, for example. The beauty of this type of plan is that it's front loaded, just meaning that although the money that comes out of your paycheck is going to come out on a payroll period basis, even if you choose all $2,650 for the plan year, but it's all available to you on day one of the plan year. So if you have a large expense at the very beginning of the plan year, then you'll be able to use all of those funds, even though they haven't technically been taken out of your paycheck. So it does have that use it or lose it feature, which is like the downside of the FSA, but the benefit of the FSA is all that money's available to you on day one of the plan year should you need to use it. And then we have dependent care flexible spending accounts, which are completely different. This is if you have qualifying child care needs or elder care expenses, you can put up to $5,000 aside. This is not front loaded. So as it comes out of your paycheck, it's available to you for reimbursement. You generally know if this is applicable for you or not. And then for signing up for this, you will need to elect this at open enrollment. This is one of those things you have to choose every year. It's not a passive election, so you have to make sure that you're choosing that this is something that you want to do. Again, we would encourage you to jot down your known expenses and then just not put more in the FSA than you know that you're going to be able to use within the plan year. And then we will send you a welcome kit in the mail. If you already have an FSA today, you're not going to get a new debit card. We just reload the debit card that you already have with those funds at the beginning of the new plan year. This is a really great way for you to be able to pay for those co-pays as well as that $450 on the HRA that you'd be responsible for prior to the HRA kicking in. We already talked about how FSA funds are not going to roll over. One of the things I like to make sure, there's kind of two pieces here. If you are on the medical plan through HMA, then you're automatically going to see claims feed into your system, just like you see on the HRA, but you can use that to substantiate expenses on your FSA. So you often, if you've used any other TPA previously, every time you swipe your card, if they can't confirm what the card was used for, they request documentation, and that's part of our responsibility with the IRS, and that's true of Health Equity as well. But because of that claims integration that we get, if you go to the doctor and the EOB that you have would properly substantiate the claim that you swiped your card for, you can match those two transactions in our system. So you don't necessarily need to upload more documentation. If you did something outside of the medical situation, like I'm trying to think of something that would apply, like contact solution or something like that, which is a qualified expense, you would need to substantiate that, but this should greatly reduce the amount of documentation that we ask for. If you do need to submit documentation, it has to have all of those things you see over on the left-hand side. The name of the provider, the name of the patient, the amount, the description of service. So it can't be like a credit card receipt. We actually need to see like office visit, for example, and then the amount, and then that's enough for us to substantiate that. We have a mobile app available. If you don't have the mobile app downloaded, it's free to download for iOS or Android devices. You can do anything on the mobile app that you could do on the member portal. I would say most people use one or the other, but you can use both. Our member services department is available every hour of every day of the year. Yes, that's 24/7. I don't know why we don't say it that way. But they're able to help you. So if you have a question about what's a qualified expense or how you submit for reimbursement, or you chose dependent care for the first time this year and you need somebody to walk you through what those reimbursements look like, you can reach out to them and they'll be happy to assist you with those questions. And then really quickly, we wanted to show you what the portal looks like, the member portal. So there's a snapshot on the left-hand side of the screen, and we're going to switch to this demo environment really quickly so I can navigate and just show you what it would look like for you. We're going to log into one that's specifically the, if I can do this, I wasn't so great at talking and typing last time. When we log in, we're going to look at the FSA specifically. Our demo environments have, see if I guess the right password. Every demo environment has a different password. Why we couldn't just choose one, I don't know. Okay, so this is kind of a good visual representation of what it would look like. Because you do not have HSAs, you have HRAs. Just pretend this is HRA, but your FSA would populate very much like this. So you're going to see your account balance when you log in. Anytime you see purple text in our system, it's a hyperlink. It takes you deeper into the portal. So if you click on that balance, it would tell you if you had any pending card transactions, those types of things. And then a majority of what we actually see done in the system is under this quick link section, where you can pay a provider directly. In most cases on an FSA, you're either substantiating a card transaction that you did or you're reimbursing yourself for expenses paid out of pocket. So you can also request a reimbursement. That's the next thing here. If you want to look at the details of your FSA, you can click on reimbursement account detail and it'll show you how much money is used, how much money is available, how much money has been withheld from your paychecks, all the details of that. And then you can also see the claim information. So we had talked about the fact that we receive all of the claims directly into our system from the file that we receive every day. It's not doing what I wanted to do. There we go. And this is what that looks like. So when I was saying you can match a transaction, you can see where all these claims load to our system. And if you were to look at the details of a claim, you have a system error. That's what you have. You can, this only happens when I'm doing it live, I swear. Usually, no, nothing. It'll do nothing for me. Basically, what you see is options at the bottom, and it'll tell you the same things you saw on that front page, which is you can pay a provider, you can request a reimbursement, or you can match a transaction to a card. And then if you get into the system and you're like, I don't remember anything that lady said when she was talking to me, you can contact member services, and they can help walk you through that process, and I'll be back there if you have any other questions as well. Any questions about your FSA or your HRA? Anything that's changing, staying the same? You're all ready to be done for the day. I understand.
You guys made it. So excited. There's one more thing that I'm going to have Julie remind you about, and then I'll take any questions.
All right, so go to the next slide. All right, so what's next? If you've logged into ADP, you probably already got the reminder that open enrollment is starting. You have until the 16th to do your open enrollment. So it's very self-explanatory. You just walk through the different, it will force you to enroll. So you can't just check a box that says keep the same. You have to go through each one. It'll go through what you're enrolled in now, your options to enroll down the road. You can add or remove dependents, change your coverage levels. So it's pretty easy to do. If you have any questions or issues come up, feel free to contact me, or you can email the Ask Benefits or Ask Payroll boxes. And yeah, there's the 6 different voluntary life and AD&D options also. So you will only see 3 on the screen. There's a little arrow, so make sure you go over to see all of your options, and you can actually click and it will give you the amounts of what coverage and what the price will be and everything. So it's pretty handy. So that's kind of what's next. And then we'll be having some Q&A times also coming up. they're on the email that I sent out to you. I don't have them off the top of my head. So, but anytime you have questions, feel free to reach out to me or Megan or email the ask boxes.
All right. That's all we have. Do you guys have any questions that we can answer as a group? If there's individual questions that you want to ask all of us, we'll be around here. Our great vendor partners are going to be here. So if you have questions, especially I know with this new Roth option that you want to talk to Carolyn about, or about FSAs and HRAs, Amanda will be here. Julie and I will be here. And then, as she mentioned, we do have 2 drop-in sessions, kind of office hour type things. We'll do one at the end of this week and one again next week. But we're here to answer questions if you guys want to schedule some time with us or just stop by. Anything you need. Anything? All right. Thank you.